Welcome to the recorded version of the Grantmakers in Aging web seminar, Training the Aging Services Field to Provide LGBT Culturally Competent Care, featuring Michael Adams, Executive Director of Services and Advocacy for GLBT Seniors, SAGE, Hilary Meyer, Director of National Programs at SAGE, and John Feather, CEO of Grantmakers in Aging, from January 21st, 2014. This event was made possible by a partnership between Grantmakers in Aging, the John A. Hartford Foundation, and the California Wellness Foundation. Technical and production support is provided by the American Society on Aging.
Thanks, Steve, and welcome to all of you. Those of you on the East Coast, I hope you're staying someplace safe and warm. But we welcome all of you to our conversation, the first of the conversations in 2014 with Grantmakers in Aging. This is part of our continuing series of monthly webinars on critical topics of interest to funders in aging. And today's topic, as Steve told you, is training the aging services field to provide LGBT culturally competent care. And we're so glad that so many of you have joined us today. Before we begin, I want to thank two of our members for their support in making this webinar available free of charge to funders in aging. The John Hartford Foundation of New York is providing continuing support for the series, and the California Wellness Foundation is co-sponsoring this month's webinar. I also want to thank the expert team at the American Society on Aging for providing technical and production support for the series. Lesbian, gay, bisexual, and transgender, or LGBT, older adults, fearful of being discriminated against, do not access aging services at the same rate as their heterosexual and non-transgender peers. When they do, they often do not disclose their sexual orientation and or transgender status to their providers, all of which leads to incomplete care and health disparities. As we talk about this important issue today, we are pleased to have two of our nation's best experts to guide us through this discussion. Michael Adams is Executive Director of Services and Advocacy for GLBT Elders, or SAGE, based in New York. And Hilary Meyer is the Director of National Programs at SAGE. Welcome to you both.
Thank you.
And as we move to the next slide, Michael, let's start with you. What are the goals of today's presentation?
Well, we'd like to start by providing a brief introduction to the work to SAGE and the National Resource Center on LGBT Aging. From then, we'll move into a brief discussion about LGBT aging and some of the particularities of the experience. From there, we'll do a deeper dive into the National Resource Center training programs and, among other things, talk about how we both achieve impact and measure impact. And we'd like to talk a little bit about what's coming next in this field and in this work before we open up to questions and answers.
Great. As we move to the next slide then, tell us more about SAGE and the National Resource Center on LGBT Aging. How do they work together, and how long have they been around, and what are their goals?
Sure. So let's start with SAGE. SAGE is the country's oldest and largest LGBT organization. We were founded in 1978, and so we're celebrating our 35th anniversary this year. We're founded as a New York City organization, but over time have evolved into a national organization with headquarters here in New York City and 26 affiliates across the country. And we focus in several areas. First, we provide services to LGBT older adults, and we'll talk a little bit later about the need for those services, both here in New York City and through our affiliate sites around the country. We also serve as a source of information and training, both to LGBT older adults and to providers in the field. And we also engage in policy advocacy to adapt public policy around aging so that it's LGBT inclusive. The National Resource Center on LGBT Aging is a project of SAGE. It was established in 2010 with a grant from the Administration on Aging, so this is very much a partnership between SAGE and HHS. One key component of the National Resource Center is that it's very partnership-focused, and so we work with 18 national partners around the country who participate in the work. in different ways. We'll hear much more from Hilary about the work, but what I'll say at this point is that key features of the National Resource Center are that it provides a resources clearinghouse website, both for consumers and providers. It also provides tailored technical assistance to providers as they seek to more effectively address the needs of LGBT older adults. And especially relevant to our conversation today, the National Resource Center develops and provides cultural competency training to providers.
Thanks very much. As we move on to the next one, next slide then, what are some of the issues facing LGBT seniors as they age?
Sure. So I'm just going to provide a brief synopsis of this, and then obviously we can discuss more in the Q&A as necessary. But one of the things that certainly that we've seen in our work over the years with tens of thousands of LGBT older adults across the country that is very much a defining characteristic is isolation. And thin support networks, and that emerges from certain realities. Our data indicates that LGBT older adults are 4 times less likely to be parents, twice as likely to be single and living alone, and often are disconnected from their families of origin. And so what that leads to is both tremendous isolation as people reach their advanced years, and also a real lack of support networks. And of course, partners and adult children are the strongest source of volunteer caregiving support in our society. So that's a defining challenge. What that does is it creates a need for more supportive services. The lack of support network creates that need. However, what we see over and over again is, in fact, that there are barriers to accessing services. Some of this comes from the fact that service providers are uninformed about this particular population, its needs and its experiences. In many cases, may assume that there are no LGBT older adults among the population, what the provider is serving, and that assumption then leads to a variety of problems. And occasionally, unfortunately, we even see garden variety discrimination contributing to barriers to accessing services. We certainly see challenges sometimes with peers in a service setting. And one of the context in which these barriers to access occurs is really a lifetime of discrimination that LGBT older adults have experienced. If you think about the fact that SAGE's constituents came of age in the 1950s, 1960s, sometimes even earlier than that, at a time when homosexuality was criminalized, was defined as a mental illness, that even today in 2014, in the majority of states in this country, discrimination in employment on the basis of sexual orientation, for example, is in fact legal. So there's a lifetime of discrimination that our constituents have faced that here again contribute to the barriers to accessing services because, among other things, they cause LGBT older adults in many cases to be fearful of accessing services for fear that they will be mistreated, that their personal information will be misused, et cetera, et cetera. And finally, one other thing I want to highlight is that what we see are higher rates of poverty and distinct health challenges among this older population. The poverty rates, in many cases, go directly back to experiences of discrimination over a lifetime that lead to wage suppression, that lead in many cases to LGBT older adults not being able to receive the same kinds of benefits that others would receive because their relationships are not recognized. So we see especially high rates of poverty, and that's especially true among older lesbians. Older lesbian couples are twice as likely to be living in poverty as older couples in general, and also especially true among LGBT elders of color and transgender elders. And with regard to health challenges, what people would most often think of, and it certainly is a very, very serious challenge, is HIV. But there are significant health challenges beyond that. We see higher rates of depression, higher rates of substance abuse among this population, and certain, although the data is very early in this regard and preliminary, certain kinds of cancers that seem to be developing at higher levels among LGBT older adults. So that's a brief overview of the LGBT aging experience, so to speak.
Thanks, Michael. As we move to the next slide, I want to remind our audience that at the end of the formal presentation, we will have time for questions and answers. And if you look at the box on your screen that will be on the right of your screen, there's a question section. If you open that section, go ahead and type in your questions now or throughout the presentation, and we will be turning to those as soon as we've completed the formal part of our work today. So, Hilary, let's bring you in at this point. Tell us a little bit about the National Resource Center's training program to address these issues.
So the National Resource Center, as Michael described, is a project with several collaborating organizations across the country, and it was established by a grant from Health and Human Services through the Administration on Aging, now collectively the Administration on Community Living, ACL, and what AOA realized is that there clearly is the population numbers of LGBT people across the country are aging, are getting quite large as the baby boomer generation gets older, and so there there was a recognition that there was a need to address this particular population or group of people in the way that several other minority groups have already been sort of addressed through ACL's grant-making abilities. And so recognizing that LGBT people really do live across the country and have specific needs in the ways that Michael briefly introduced us to, there was a clear path that we needed a group to sort of take the lead, bring the groups together that were already working on these issues and try to address some of them. And so with that, one of the primary missions of the Resource Center when it was established back in 2010 and remains today was that we need to reach service providers, that people are having access to LGBT older people and help them to understand why aging as an LGBT person may be different than as a heterosexual or non-transgender person. And with that, we started to sort of test out how we could reach service providers in getting this training, these training offerings to them, and realized that one of the biggest barriers that we have to overcome initially is to help service providers understand that actually they're serving LGBT people, whether they know it or not, and then to take it to the next level, which is why is it different, right? And so with that, we needed to really build a comprehensive training program to sort of address the initial pieces of that, and then to delve into how to actually get service providers to a place where they feel comfortable in providing the person-centered care for the LGBT community.
As we move to the next one, tell us about how this training curriculum is designed.
So when we brought the various organizations with whom we partner together, we selected the groups that were already doing some form of LGBT or aging training to providers in different parts of the country. And so from that, we gleaned our training committee, and in that group included the LGBT Aging Project out of Boston, Centerlink, which is in Florida, which is an umbrella group of LGBT organizations, Griot Circle, which is out of New York, works primarily with the African-American LGBT aging population, Open House in San Francisco, working with LGBT aging folks, the Forge Transgender Aging Network out of Wisconsin that specifically works on transgender aging issues, and of course Sage as a project lead, who we've been doing training for a number of years up until this point, and so we brought all these groups together and worked with the organization called PHI, who is really a professional, an organization designed purely to train or provide various types of trainings to long-term care staff in different ways. And so with PHI's help as the expert in training curricula development, all of these groups came together, brought all of their training materials together, and over the course of about a year, we combined all of our training to create this really comprehensive curricula for both aging service providers and LGBT organizations, understanding that for LGBT organizations, helping them to become culturally competent in working with an aging population is also a significant need as well. So what we came out with were 4 trainings, 4 hours each. 2 were designed for the aging services aging service providers, and 2 are designed for the LGBT organizations. And then, of course, we needed a way to make sure that it was working. So Hunter College, through their School of Social Work, was or continues to be our evaluation partner. And I'll walk you through a little bit more about how we measure change later on. But they were with us through the process of developing the curricula and making sure we had a way to evaluate it appropriately. And so the curricula then really incorporates a number of different modalities of learning. Based on PHI's expertise, we were able to understand the different types of ways that adult learners are able to absorb information. We have our training involves small group work, large group work, role playing, etc. So that's all our in-person, most comprehensive trainings that we developed initially in that first year period.
Okay, as we go to the next slide, what are the objectives of the training?
The objectives are fairly simple in the way that they're stated, but of course they're quite complex in the sort of subcategories that we delve into. But as you can see on your slide here, the key objectives to all of our trainings are we want providers to understand the culture, needs, and concerns of LGBT older adults, and that sort of gets into why is this different? What makes this different? We want folks to understand why LGBT older adults are less likely to access the services. So we know that aging providers want people to access the services. They have plenty of services available, but why are LGBT people reticent to do so? Right? And then we get into helping people understand what are the best practices that we've learned so far as this conglomerate of groups in how to actually help LGBT older adults feel more included, access the services more frequently, and get them to a place where they feel comfortable in coming into the door and then receiving the culturally competent care that's necessary.
As we go to the next slide, then, how does this training respond to the needs that various providers have expressed?
So you can see the first 2 bullet points there, the Aging Network trainings and the LGBT organization trainings, are the trainings that we developed initially in our first year of the program. As we begun to roll the program out, we realized that there was also a need for a shorter, sort of more introductory level training for aging providers who might be a little bit tighter on time. So we incorporated a 1-hour interactive presentation into that training mix, and just very recently, in the last month, we have debuted our ability to actually create live webinars on these topics as well, which sort of helps providers who have even less access necessarily to an in-person training. That will also be available as a way that folks can access this information. And Michael will talk a little bit more about that as well at the end.
As we go to the next slide, I want to remind once again everyone that we will have questions and answers at the end of this presentation. Just go to the box on the right of your screen and open the question box and type in your questions, and I will be providing those to our speakers in just a few moments. So as we go to this next slide, where are the trainers located?
So when we when we built this comprehensive training, we obviously needed trainers to go out and facilitate these trainings. And so what we did was we did a series of 2 different Train the Trainers. So all of our in-person trainers are certified by us. They've gone through our training program, and they're in geographically diverse places in the country, and that's they're situated based on what we saw from the need that after we started doing the trainings, we looked at where training requests were coming in, where there were larger pockets of LGBT population, where we really needed to reach providers, and so we situated trainers in different parts of the country. And so at present we have about 20 trainers. That number fluctuates depending on what's going on with the trainer at any particular time, but those are the folks that are in those states that are our certified trainers.
Okay. Moving on to the next slide, what has been the reach and impact of the training program so far?
So actually, before we get into that, I wanted to just mention that we've completely centralized all of our training requests online, so that folks who are interested in learning more about what trainings we provide and then would like to request one, we've put it all on an online form so that we can obviously keep track and make sure that we're reaching everyone that's requesting a training, but also we have a way to centralize the data to understand who's requesting what and at what time, and to make it really easy for providers to go online and request some of these trainings. So I put a screenshot in here of our training request form. It's a simple form, and people can access it at any time, day or night.
Okay. As we go to the next one, then, see, where has the training taken place so far?
So you see this map here, and there's really no differentiation between the blue and the purple. I just mixed up the colors for ease of viewing. But these are all states where at least we have reached in a provider in person. Either not necessarily in that state, but either at a conference or they've joined another training. But providers who have been trained sit in a number of these states. So right now we're up to 30. That number actually does continue to grow fairly regularly. And I'll tell you a little bit more about how we're tracking that as well for consumers to be able to access that information.
And on the next slide, how many people has the training reached?
So at this point, we're up to about 3,300 providers that we've reached for our in-person trainings. As I said, we've recently moved into the webinar sphere as well, and we expect that those numbers to grow quite a bit. But in our first few years of our training program, we're now into our 3rd year, we've reached 3,300 providers so far.
That's a very large number for a startup program like this. And as we move on to the next slide, what are some of the kinds of organizations that have received training?
So this is just a sample list of the different types of providers in the aging network that we've that have been interested in, that we've reached with our in-person trainings. We've trained some state unit on aging, the area agencies on aging, which of course are the regional government entities that provide the aging network services in their states. The ADRCs that we've trained, the Aging Disability Resource Centers. Again, those are government-funded agencies that give information to consumers about how to access different services. We've trained a number of behavioral health organizations, so groups that are providing sort of case management, mental health services. Community-based aging providers, that's a pretty broad network of folks doing all kinds of different services in the aging field, such as home health, the buddy-to-buddy sorts of systems, groups that are reaching older adults as their primary missions. Social work student programs has been an area of interest. A number of social work schools have been interested in our training programs, and we've had trainers go in and as part of their curricula, gone through our training program. And hospice organizations have taken some interest in our training as well, providing sort of end-of-life care in a very culturally competent way to the LGBT community.
Okay. On the next slide, are there additional online resources as well?
Yeah, this is where I wanted to talk a little bit about a brand new feature that we launched 2 weeks ago, and we've created a database that is accessible to anyone who visits our website that allows people to search for places where there have been providers who we have trained in their city and their state, and there's a number of different ways that people can search for the information. So if we go to the next slide, you can see that this is a snapshot of our screen where you can choose the type of training that an agency has had. You can search by agency name. You could plug in a search just by a city and state or a type of organization, and you get all different kinds of search results. And the reason that we thought this was really important and that I'm really excited about this particular feature is we wanted people, LGBT people across the country, to know where there have been where people and agencies are accessible to them, and the primary mission, of course, of the Resource Center is to improve the lives of LGBT people as they age, and in this huge training effort that we've undertaken, we realized that in order to be truly effective, we wanted to make sure that consumers understand where they can go, where providers have learned from us about the needs and how to make their services inclusive. And so this database will continue to be updated as we continue to move through our training effort, but it really dates back from the initial trainings that we offered through present day. So I'm pretty thrilled about that piece of our work that we just launched.
Well, that's a great additional service. As we move on to the next slide, what are some of the performance indicators that you're measuring?
So we, as I mentioned, our evaluation partner is the Hunter College, the Silverman School of Social Work. Our primary evaluation lead is Professor Nancy Junta at Hunter, and what she did was she went through and created the evaluation tools for our various training efforts. And what you see here is, I put this up for those who are interested in the sorts of nitty-gritty evaluation measures that we look at that measure changes in knowledge, changes in attitudes, and changes in skills for our in-person training. And we do this by a pre-post measure, so we have people come in right at the beginning of the training. They take a pre-test, and then when they leave our training, they take a post-test. And Nancy's team plugs this data into SPSS and measures it and analyzes the changes. And so far, we've seen significant changes in some of the knowledge and attitude measures. The skills base we measure for the full 8-hour training, so that's a smaller group, but the knowledge and attitudes have changed significantly in a number of the categories.
All right. As we go on, what are some of your initial findings?
So what I have here is we've begun to integrate a new measure of change, which is we are now surveying people 3 months out after they've been trained by us. So right now we have the pre and the post of the day of training. But we're pilot testing a measure of getting people to respond to a survey after 3 months after they've had our training, to understand if actually anything that they've learned is sort of sticking and being a part of the work they're doing moving forward, which of course is fundamental for us. We want people to learn and then integrate what they've learned into their daily work. And so what you see here, I put in some of the sort of primary findings that we've found in our pilot test of these measurements, and we've seen largely positive changes, especially around people's ability to understand why it's important to use inclusive language, how to help people to find information, especially for new employees. That's obviously a big group for us, for folks who aren't trained by us directly. How are they then passing this information on to the employees that are coming into their agencies, and additionally trying to we were able to see that groups are trying to include LGBT inclusive information, sort of giving that visual clue to the LGBT community, or integrating it as part of their forms and policies and procedures about how LGBT people are included and are thought about as the part of the agency's care, and of course trying to understand whether people now have gotten past the initial barrier that I talked about at the beginning, which is, we don't have LGBT people here. Why is this important to us? And we've seen really positive results for them understanding why it really is important and why these training efforts are critical to that person-centered care. And at the bottom here, I put together a sort of visual word jumble, which is these were some of the more popular words that popped up in our open-ended questions in this 3-month performance measure. Some of the sort of key things that people have thought about and continue to think about after a number of months out of our training.
All right. Thanks very much, Hilary. And Michael, let's bring you back in on the next slide. So we've heard about the wonderful effort that's going on so far. So what's next for the program?
Well, we're, I think, as you've seen, that there's an incredible body of work that's been developed in the National Resource Center's first 3 years of training. And, Hilary and her team have done just an extraordinary job of thinking, as we look ahead, as we look to the next chapter of this training program, how can we be as strategic as possible to ensure that we maximize the impact of this training work? I mean, one of the things that we certainly recognize is despite our efforts, resources are limited, and we will never, fully penetrate the provider network across the country. And so what you see here are some of the key themes that are emerging to ensure that in the years ahead that we really double down and focus in on strategies that will maximize our impact. And so, for example, one of the things that we're looking to do are to continue to add webinar options on a range of topics, but I think we wanted to highlight here topics including trans aging, for looking at the aging experience of individuals who are transgender and the aging experience of LGBT people of color. There's both two subpopulations where not enough attention has been given, and we want to make sure that our training programs really are responsive to their particular needs and experiences. In addition, we've done some, I think, really good and helpful brainstorming about how can we reach key stakeholders, key opinion makers who themselves are important in terms of the roles they play in shaping the provision of aging services and are influential with other key stakeholders, so with the real opinion makers. And in that regard, we've set a goal of reaching 100%, achieving 100% reach at the highest levels of state government agencies on aging, in the sense that making, at the highest level of every state government agency on aging aware of the availability of our training, so at a minimum achieving that awareness, but in fact going beyond that to present and train to 80% of the state's highest level government agencies. So that's a really important area for us as we seek to really penetrate the upper echelons of state leadership, governmental and agency leadership on aging. Another really important area that we're very excited about is the notion of reaching and training key trendsetter healthcare systems, especially in densely LGBT populated areas. And our thinking here is this, which is that we know that in major urban communities across the country, there are, major long-term care providers and other such systems. And to the extent that we are able to partner with them to provide comprehensive LGBT cultural competency training, first of all, that we are going to have a significant impact given the numbers of individuals that those healthcare systems serve. And in addition to that, we want to really support them in becoming, in a sense, industry leaders in their industry in order to encourage their peer healthcare systems to do what they've done as well, to follow in their footsteps and do the same thing. And we're involved this year in a very exciting project along those lines with Jewish Home Life Care, which is one of the largest long-term care providers in the New York City metropolitan area, to do that kind of intensive training, not only because of the thousands of people it will impact through Jewish Home Life Care, but also because we believe and we hope that by their stepping forward as an industry leader, it will encourage others to follow in their footsteps. And then one last thing I would mention is that this field of LGBT aging cultural competency training and the work of the National Resource Center is very dynamic. It is developing. It's growing all the time in response to what we perceive as new opportunities and new challenges. And one of the irons we have in the fire, so to speak, is a long-term care index, which would be a joint venture of SAGE and the Human Rights Campaign. This is actually modeled on a so-called corporate equality index and healthcare equality index that the Human Rights Campaign developed several years ago, which essentially asks entities to self-rate against a number of criteria that are indicia. In the early indexes, they were indicia of good corporate citizenship and good healthcare delivery for LGBT older adults. In the new long-term care index, they would be indicia of appropriate, respectful, effective treatment of LGBT older adults in long-term care. And what this index would do is that it would hopefully bring together a critical mass of long-term care organizations who would self-score and allow us basically to publish those results, which would both be a resource for LGBT older adults themselves as they seek out LGBT-friendly long-term care opportunities or services. And in addition, we think would have a market impact. Certainly what we've seen in the earlier indexes is that as you start to attract a reasonable number of participating companies, or in this case long-term care providers, into the index, those entities want to achieve good scores, and then that encourages others in their field to do the same thing. So that's just a kind of a sampling of what we see ahead in the next couple of years of this work.
Once again, we're almost to the end of the formal presentation, so I invite you to write your questions in the question box you see on your screen. But as we move to the next slide, Michael, obviously as Grantmakers and Aging as an organization made up of foundations and other funders, we want to particularly focus on how funders both at the national and local level can be involved in this effort. So what is some of your advice for our funder partners?
Sure, absolutely. And some of this really would double back to what I was just describing a moment ago in terms of where we're heading with this work and much of what Hilary described earlier. First, for this training work, it's critically important that we are able to access key governmental aging agencies and, in addition, healthcare systems, and convince them that this training is important to them, that it will actually help them recognize that, in fact, they're already serving this LGBT older population, and that there's more that they need to do to do that well. Our sense is that funders could play a very important role in terms of making sure that the governmental aging agencies that they work with are aware of this training resource, are aware of the importance of cultural competency around LGBT issues, and that funders can encourage governmental agencies to participate in training programs and receive training. And there may be instances where it will be appropriate for funders to consider funding government agencies to engage in such training. So that's one area where we would see a real role that funders could play. A second area involves conferences, and certainly an important part of the way that the National Resource Center has delivered its training over its first 3 years has been through a whole variety of types of presentations at regional and national conferences that focus on aging and health issues. And we have a growing presence at those conferences, but we are certainly seeking to increase our presence and therefore to increase our level of impact on this field. And we know obviously that funders play an important role in participating in such conferences and financially supporting such conferences. So we would encourage funders to advocate for LGBT inclusion in region and national conferences, and sometimes that inclusion, it comes with a price tag, and so for funders to consider the possibility of providing funding for, either for participation in a particular conference or a series of conferences. A third area is we have so much more work to do to expand and to build our capacity to train around the country. And if you recall the slide that was shown earlier, at this point, as Hilary described, we have approximately 20 trainers for the National Resource Center in 16 states in the District of Columbia. We need to, within the states where we have training corps, we need to strengthen and deepen that training corps. And then, of course, in the majority of states in the country, we don't yet have trainers. That's really all about resources. And so a funder that is located within a particular state that is interested in helping to expand the LGBT aging cultural competency training in the state, if it exists, or to help get it off the ground if it doesn't exist, that's a very, very important role that a funder can play and have a real impact on the ground. And then finally, of course, what we're describing here is a training program which is dispersed across the country, which occurs on the ground in communities across the country and with providers across the country. But it is part of a national effort and part of a national infrastructure that Hilary has described well. And so the infrastructure itself, the National Resource Center on LGBT Aging, needs support to continue to expand its training offerings. And then we are periodically developing really exciting national projects like the Long-Term Care Equality Index with SAGE and the Human Rights Campaign that I described last month, which will start as a national project, but has the opportunity to be spun off into pilots at a regional level.
Well, thank you, Michael and Hilary, for that wonderful summary of this program. And at this point, we will turn to the questions from our audience as we move to our last slide, which has the contact information for our speakers so that you can contact them directly. And we have a lot of questions, so we will get as far as we can, but you can also contact the speakers directly at the addresses and phone numbers you see listed here. So let's start with the first question. And Hilary, I'll address this one to you. What would you say were the biggest hurdles that you had to overcome in getting service providers to buy into the training, or perhaps even more importantly, to use it once they had received the training?
Well, using it once they'd received the training, just based on our evaluation results, seemed to have been not that difficult of a hurdle. In fact, I think the efficacy of our training is really that service providers, once they understand the issues and have some empathy and have action steps that they can take back to their agencies and organizations, that hasn't been difficult. The challenge is getting folks to understand that they need the training, and that's one hurdle. That we want providers to understand that this is a large population, that they have specific needs, and also, of course, I'd say our overarching issue is purely a capacity issue, in that we have certainly got agencies who are interested in receiving training, specifically the in-person trainings, that we just don't have trainers in their states, or it's cost prohibitive to get a trainer there, and that's where Michael had discussed the issue of having the ability to increase our capacity up for on-the-ground trainings. Is pivotal for us, and part of the way that we're trying to address that with the resources that we have available at present is opening it up into an online atmosphere as well, where we're giving people information in a webinar format where they can request a webinar to be delivered to their agency. Of course, the webinars are a different type of learning modality, and we would at this point we understand that our in-person efforts are the most effective, but those have been the biggest challenges and the ways that we've been trying to address them.
All right, let's stick with you, Hilary, and ask a couple of more technical questions. One is about the cost, and the other is about the training in terms of, particularly on the webinars, are those available anywhere? And you've addressed that to some degrees already. So a question about the cost of the training, and also about the trainers themselves. Are they all people from the LGBT community, or are they come from a variety of backgrounds?
The trainers themselves do come from a variety of backgrounds, and we have an application process for folks when we were hosting Train the Trainers that asked a variety of questions about people's backgrounds, and certainly did as part of the picking the folks who would be trainers took that into account. And in fact, all of our certified trainers are on our website. Their bios and pictures are listed on there, so folks can look through and learn a little bit more about our trainers. As it relates to the costs, we have moved into a portion of our sustainability efforts in terms of keeping this training program going and growing it at the level with which we see the need, and have started to, on a sliding scale basis, charge agencies depending on a variety of factors related to the size of their agency, the number of people to be trained, and so forth. Because of our different obligations and interest in training the aging network, those groups who are receiving funding directly through streams related to the Administration on Aging are actually fully scholarships, so those agencies are able to access the services, the training services, free of charge. But that's not the case going forward for different agencies. But we've done a pretty critical analysis of the cost that it takes to do our various training programs, and are trying to pretty closely align that with a sort of cost recovery method so that we can continue to do these trainings. So if folks are interested in receiving training, those are conversations that you would have directly with our manager of education and training upon request of the training services. And the webinars are, yes, fully accessible. That the agency would need to have an internet connection and the ability for the providers to be sitting at a computer screen, and it doesn't even necessarily have to be one provider per screen. You can do group showings, but the intention was that we could schedule webinars with agencies on a one-on-one basis, and that's very recent in our training offering. So I'm excited to see how that goes. So far, we've actually had a number of requests, even just in the first couple of weeks of offering the service.
Well, that's great. Michael, let's bring you back in because this is an area that I know that you've worked a lot in. And that's the question about multicultural views on sexual orientation. We know that across the world and across different cultures, the views on these issues vary. But the question asks, how do you address these multicultural views on sexual orientation, both in the clients that you're serving, but also in the staff of the facilities that you're working in?
So I'm going to start with a response on that, and then I'm going to pass it over to Hilary to add to that. It's been very important to us in the development of this training work, as in other aspects of SAGE's work, that we are respectful of cultural differences. We recognize that we don't live in or seek to live in a cookie-cutter, one-size-fits-all society. And so as part of the work of the National Resource Center, we have partnered with a number of organizations in developing our thinking and training, et cetera, around these issues. So we have worked with organizations like the National Hispanic Council on Aging and the National Caucus and Center on Black Aged, who have been members of the Advisory Council for the National Resource Center on LGBT Aging, to ensure that, in fact, as we are creating cultural competency training, in fact, our training is culturally sensitive and recognizes that we live in a multicultural society. I think it's important to emphasize that in our training, we don't seek to challenge the philosophies, the religious beliefs, the personal views of individuals, their value systems, et cetera. These are trainings that focus on behavior and the results that behavior can have with regard to individuals who need services. Sometimes those behaviors tie into professional ethics codes, professional responsibilities, et cetera. And I think that's an important distinction. With that, I'm going to pass it over to Hilary to see if she'd like to add something.
As Michael said, our trainings are actually quite developed around the issue of specifically around race and ethnicity diversity. In that's another piece of something that providers who aren't necessarily thinking about these issues day in and day out as we are don't realize, which is that LGBT people are span across all kinds of different folks that live in the United States, race, religion, cultural identities, and so that when we go through our training, that's actually heavily emphasized, that there are multiple issues that folks have to be aware of, specifically around minority aging issues, not just related to LGBT, but that can compound the issues of being LGBT, including issues that arise in different cultural identities, and how groups are responsive or not necessarily as responsive. So we certainly focus on that as part of our training efforts, and as it relates to providers who may be having difficulties, as Michael said, we're not seeking to tell people that they have to change their personal beliefs. We work from the premise in our training that everybody that is working in aging services is trying to provide the best possible care to all of their clients. And so working from that premise, helping people to understand what the best possible care is for groups that have felt marginalized, that have felt isolated by service providers over the years, helping them to understand by using personal examples that have nothing to do with sexual orientation or gender identity, to understand how that isolation may feel, and then moving that into understanding the historical complexities of the LGBT community, especially our older adults right now, that's sort of how we help to get providers to a place where they understand why this is important, and and we certainly had some training situations where folks were not interested in being in the training. They were being mandated to be there, but the trainers are prepared for that. That's part of the training process, is to understand how to work through those difficult times. But for the vast majority of trainings that we've been doing, folks have been receptive, and even through the work with our trainers have been able to sort of get to a place where they understand why these issues are important, regardless of whether you have different a different belief system about sexual orientation and gender identity and what that means either religiously or culturally.
Well, unfortunately, we're getting to the end of our hour. I will ask all of you who have submitted questions that we weren't able to get to talk to Michael and Hilary on with the numbers and email addresses you see on your screen. But I want to turn now to asking our speakers if they have any final comments for our audience today. And Hilary, I'll start with you.
Well, I would be remiss to not recognize that we have other organizations that have supported our efforts along the way. The Retirement Research Foundation, the Gill Foundation, both have been primary contributors to our training efforts as well. And our national partners, I would encourage folks to go online to our website and take a look at the vast diversity in the national organizations that are a part of our efforts. We have 18 at present, and it really represents sort of the strength of the groups that are behind this effort. So I want to thank you all for listening in and hearing more about our project, and also recognize all of the folks that have been heavily involved in this project thus far.
Thanks, Hilary. And Michael?
I think I would just note in closing that it's really important, the conversation we're having around resourcing. The National Resource Center began as a project supported, and is still supported by the Administration on Aging. So obviously there's a very important public funding component here. At the same time, for a project like this, a training initiative, to have the kind of impact that we need it to have, that's only going to happen through private interest, through public-private partnership. I mean, that would be true in any era, and it's certainly true in this day when government support for even the most important initiatives can be called into question. We're very, very fortunate to continue to have a great partnership with HHS and the Administration on Aging, but the private support and the private interest, including from the philanthropic sector, is critically important for the success of this work.
Well, I want to thank Hilary Meyer, who is the Director of National Programs, and Michael Adams, who is Executive Director of Services and Advocacy for GLBT Elders, or SAGE, for their participation in today's program. We thank them for all that they do to make life better for America's older adults. I also want to thank the John A. Hartford Foundation and the California Wellness Foundation for their support of this program, as well as the American Society on Aging for their technical expertise. And finally, I want to thank all of you for participating in today's webinar. Have a great day.